On today's episode, we're talking about something that might sound simple on the surface: hypermobility. You think it just means being extra flexible, but the truth is, it is so much more than that. Hypermobility can impact multiple systems in the body, affecting everything from joint stability to digestion, nervous system regulation, and even your mental health. In today's episode, our guest is sharing her personal journey with hypermobility, shedding light on the daily challenges, the wins, and the lessons learned along the way. We'll discuss why hypermobility is often misunderstood, the importance of advocating for your own health, and how closely the mind and the body are connected in managing this condition.
Welcome back to the Besties Unscripted podcast with Grace and Kaylee, your ultimate guide to navigating the realms of physical, mental, spiritual, and emotional well-being.
Join us as we delve deep into the art of self-discovery and empowerment, uncovering the secrets to living your best life. No scripts, no filters, just real talk with your favorite besties.
I am so excited. We have Jen Avery with us, my dear friend, and also someone who I can go to for all of the information. She is a research queen, so I'm super excited to learn from you today.
Welcome, Jen. We're so happy to have you here.
I'm excited to be here. I love Kaylee. I haven't met you, Grace, in person, but we've chatted before, and I just love like chatting with y'all. And I'm really excited to share on this topic because this is a new passion topic, and I have dived real hard into this topic in the last 6 months.
Yeah, and I think it's a topic that not a lot of people are so aware of. Whenever we were talking a little bit about this, there was already things that I had no idea that hypermobility could cause in your everyday life. So to keep it simple, let's go with what is it? What is hypermobility?
Yeah, so I do want to preface for this podcast's sake, I'm going to say hypermobility, but I'm using it as an umbrella term, but really I'm talking about connective tissue disorders. However, it is so much easier to say hypermobility than connective tissue disorder. So I do want to preface that I am going to go over different types of connective tissue disorders, which include hypermobility spectrum disorder, joint spectrum disorder, and then also Marfan and Ehlers-Danlos syndrome. So, like I said, I'm going to use hypermobility as a catch-all phrase because it's just easier, but definitely touching base on the other branches of what hypermobility is. It's a connective tissue disorder which affects everything from your brain to your vessels to your skin to your stomach to, of course, your joints. It can be, and it's a spectrum, right? So hypermobility for someone could be just like hitchhiker's thumb, right? Or be able to like contort, bring their arm behind their head, so they're like licking their armpit. But then there's to the point where it's almost impossible to function and you have to spend a lot of your time in bed, or you sleep and you literally dislocate your shoulder by just existing, right? So it is across the board. And what's really interesting is how much people don't know that they have it. And studies are saying between 20 and 30% of the population. And that's just diagnosis. There's a lot of comorbidity, right? And there's a lot of doctors that don't understand it. So that's actually probably way higher. But in general, about 20 to 30% that we know of have hypermobility, at least somewhere on the spectrum.
And are they born with this? Is this something that you
Yes.
and is it
Yes.
genetic?
Yes, it is genetic.
Okay.
I do want to preface, like, I'm a yoga instructor that specializes in hypermobility. I am not a hypermobility doctor. So I don't know if it's a generational skipping type of disorder or if it's literally straight lineage passing from grandmother, mother to daughter. But there are a lot of studies that are proving that it is genetic.
Wow.
I think it's interesting that 20 to 30 of the population, 20 to 30% of the population and potentially more have this. And I had no idea there was like even a spectrum. So For
Mhm.
someone that yourself, like that, when you're learning about this, how did you start to discover that this was something that you have?
Okay, this is gonna blow your mind. Are you ready for
Yes.
this? My origin story is weird.
Love that.
So I will preface throughout my whole life, I have dealt with injuries, didn't understand why. And things started clicking for me with, of course, TikTok, right? TikTok is phenomenally helpful, but what really started it was the book Fourth Wing.
That is
Reading Fourth Wing, a fantasy novel about dragons. And I will say, this is why representation is so important
mm,
because the main character, so the author has Eller Stanos, and the main character, she doesn't like have a specific diagnosis, but she's always hurting herself, subluxating, dislocating, having to wrap things, just having general weakness, struggling developing muscles. And I was like, wait 1 second, like, wait a second. And it just kind of started clicking. And of course, TikTok's always listening, right? Always listening. And
yes,
I
they
started
are.
seeing a couple videos. And then, of course, the way the algorithm works, you look at one video, suddenly you're given 3, and then 5, and then 9, and then your entire feed is nothing but a particular subject, right?
Mhm.
And I don't remember, there had to have been a video, obviously, that was like, oh, I'm hypermobile. Can you do this one thing? And it just kind of started kicking in. And then, I mean, it was such a slow process that when I decided to become a yoga instructor in September 2024, I immediately started doing yoga like every single day. And it hurt so bad. Like, it hurt so bad. And I couldn't understand why. And I was already injuring myself again. I'm like, this is freaking yoga. Like,
Yeah.
why am I hurting myself?
And
And just slowly but surely, the universe started handing me little bits of information and it started clicking. I started researching in books, websites, studies, and I was like, I'm hypermobile. And then I found out that despite a large majority of yoga practitioners being hypermobile, it is not talked about.
mhm.
In fact, yoga can be one of the most detrimental things a hypermobile person can do if they are not educated that they are hypermobile. So that's why I decided that I was going to specialize in hypermobility because I see what people are doing. And I'm like, you are going to need a hip replacement when you're 50
Mm.
if they
So
continue doing these things.
so when you say, like, you started yoga and you had pain, like, everything hurt so bad, can you describe the feeling of that? If there's anyone listening who is struggling with they want to get fit, they wanna gain muscle, but they just constantly hurt if it's whatever they're trying, what is that feeling of pain? Can you describe it?
It really is just inflammation of my joints,
Mm,
right? Like, so hypermobility at its base core is a connective tissue disorder. And what that means is while we all have collagen, for normal quotations, normal people have collagen that is like steel cables, right? Hypermobile people that fall under the spectrum of connective tissue disorder, their collagen is more like a rubber band.
mm,
And on top of that, there is a significant struggle to build muscle around the joints. As a result, when you're doing stretches, it is very easy without those muscles to stop your joints. Your joint literally just goes like, so like, say this is like a knee, right? My knees personally don't do this, but they call them banana knees. And when someone is standing, this is like a knee, right? Right, like just straight, but a banana knee will bend backwards like this, right? And it's because they don't actually have those support muscles to stop them going past the anatomical barrier.
mm,
And that's really what it is a lack of support in the anatomical barrier. So when I was starting to do yoga, I when you move too fast with yoga, especially if you're doing vinyasa, what you're doing is going end range completely into your joints if you aren't paying attention. So all of my joints hurt. My tendons started getting irritated. I've been having struggles with like my wrist, and like I got to the point that I couldn't use my arm at all. And I didn't understand what was happening. Like, why is my hip worse? Like, why is my arm like I'm doing yoga? And that's really what I've learned is happening for a lot of yogis is that they do yoga and they think pain is the price for perfection.
Mm.
So they're doing things like the splits or back bends or some of the most extreme ends of poses. And I'm not saying everybody going to the extreme end is hypermobile and hurting themselves, okay? A lot of them are. Like a lot of them are. And so they think this is supposed to hurt this much.
Oof.
It's normal, like, yeah, I'm doing the splits. Why wouldn't I feel my hips grinding? Why wouldn't I feel this sharp pain when I'm like in a double twisted pretzel knot? Like, they don't understand what they've done is gone past the anatomical barrier, and they're literally putting all the pressure on their joints and literally grinding their bones together.
Yeah, I think this is why it's really important for two things, which is one, to understand the difference between pain and being uncomfortable. I think when you're trying
Mm-hmm.
something new, sometimes there is a feeling of or a sensation of like, wow, this is like for me, if I'm sitting in what do you call that chair pose and I'm like
Mm-hmm.
setting in deeper, I'm like, damn, this is uncomfortable. Like I don't love this
Right.
feeling. My body's like, I want out of it, but it's not because I am in pain. And I know from
Mhm.
personal experience in yoga classes, like you hear an instructor say like, if this is causing you pain, then like please back off, like don't do it. But to your point, Jen, I think it is maybe a lack of education, a lot of misunderstanding, a lot of people, like you said, not understanding that their body is susceptible to hypermobility they are hypermobile in this way. So I feel like that is really, really important to one, know the difference, and also to have conversations like these where it's education. Like, I'm sorry, and I think Kaylee could speak to this. If you're working out and you're like, damn, this hurts, like you should never feel stop.
Mhm.
Yeah. If there's a sharp pain, don't do it.
Stop.
In my sessions, I'll be like, "Is it a good hurt? Like, are we burning? Are we
Yeah.
mind muscle connecting? Or do we need to pivot and do another movement?" It's
Mhm.
really important, I agree, to have an instructor like yourself who can say, like, "No, we don't want that grinding feeling. We want, this challenging feeling that's going to give us that progression overload
Mhm.
and, challenge our muscles." Another thing that made me think, so Jen and I have worked together and we had to have you go on gluten-free strict diet. Like Jen she's very sensitive to dairy, all of the
Mm-hmm.
things. But as I was diving into this before our recording, I saw gut issues could definitely be something that people with hypermobility deal with. Do you think that your issues with food maybe could connect to the hypermobility?
100%.
Mhm.
Yeah.
So, food sensitivities are a really big issue for connective tissue disorders because the main thing with connective tissue is, aside from the joints, is the muscles. So, muscle gaining is very difficult, but that also means there's an overlaxicity of the muscle, right? Your intestines are just muscle, right? They contract to move the waste along. If your whole body is a connective tissue disorder, those muscles actually struggle to contract enough to move the waste. So constipation is a huge problem for people with hypermobility. And I just saw a gastroenterologist, and there's no cure. Like, this is going to be a lifelong management thing for me. And but also the way it ties into food sensitivity. So there's a few different levels, right? So say if you have a lot of people with Ehlers-Danlos they have what is called mast cell activation syndrome, or MCAS. And what that means is, just in layman's terms, your body is supposed to process histamine. There's a lot of things in the world that give you histamine, not just like sear in the air, but also like leftovers. Leftovers actually have a lot of histamine. Now, with mast cell activation, your body struggles to process and recognize these things that are inflammatory. That also can tie into DAO, and I cannot remember like the actual scientific term for this acronym, but DAO is an enzyme in your belly that helps process this histamine, any histamine.
Mhm.
When your body does not produce enough DAO, then what happens is it starts to irritate your stomach. Then the stomach, because it can't contract, then it starts wearing away at your stomach. It's not getting the enzymes. It starts eating at the walls of your intestines. All of a sudden, next thing you know, you got leaky gut. You can't have gluten suddenly when you could have it, or even something as like with me, potato, can't have it. It all kind of ties together.
Mhm.
And that's why a lot of people have gut issues, is genuinely they just don't have either their muscles are too lax, or they don't have the enzymes required, or it's all of it.
See, that's
Yeah.
interesting because I know as a patient and just as a human, it's really hard when you have a conversation with your doctor and they're like, this is a lifelong management versus any type of cure. Do you feel like you have, with all of your research, I know you like deep dive into things, have you found the resources and the right kind of people to provide information on what like lifelong management would look like for something like this?
I did get a food allergy test back in 2021, and I had asked for like a larger panel, and it like checked for different things I'm allergic to. And it told me that my body struggles to process histamine. I didn't know what that meant. And then when I looked at what's in histamine, I was like, yeah, I'm not going to care about that. Like, what? No spinach? Like, oh, I'm not doing that. Like,
Find
leftovers?
that.
How am I going to meal prep? Like, not like I actually meal prep, but like, I wanted the opportunity.
Mhm.
And beef kidney has changed my life. Just introducing in the last 3 weeks actually helped change my gut biome to have the enzymes to process histamine better.
Mm-hmm.
So what that supplement is doing is just adding in those extra enzymes so you can
Mm-hmm.
digest better. Okay.
Yeah, and I mainly also got it because of joints. So I got the fish oil for my joints, and the beef kidney is also really good for your joints. So that was my main motivation.
Yeah.
I haven't noticed a huge difference for my joints, but it's only been 3 weeks.
Right.
But somehow I can eat potato and gluten without problems. Like, that's
Yeah, it's
crazy.
really
Yeah, and we'll
cool.
link that.
Mm-hmm.
We'll definitely link that. Send us
Yeah,
the one you recommend because if that can help anyone, we want to help as much as
Well,
possible.
and it's
yeah,
interesting because basically we love supplements because all it's doing is supporting your body and functioning the best way that it could possible, and it is like a
yeah,
typically a longer experience, and we as consumers
Mhm.
and in this day and age love like a quick fix, and so that's not necessarily what supplements will do for you, but it does sound like in your instance you did see results really quickly. For anyone, that's like very, very exciting. I was gonna say I'm
yeah.
interested in beef kidney. I had heard latest craze was beef liver for like hair growth and skin.
Mm-hmm.
So now I'm like, damn, I just need to buy a cow and like purpose the whole cow for
Yep.
beauty and for health. But I love animals too. I felt like that.
So I have a brand, Force of Nature, and they will mix all like the heart, kidney, liver into the meat, and I feed it to my kids. You can't even tell. Hot tip there.
Really?
Yeah, it's
My
really
Okay.
good
husband can
too.
tell.
And
He told me the
oh,
other
my kids cannot,
he
dude. My kids
that's
cannot.
amazing for a
So I
kid
feel
to
like
not.
that
Yeah.
is
Yeah, yeah.
a good test. And they're local, like they're in Austin.
Mhm.
They
Oh, okay.
they kill humanely. They like will I think go and like bow them,
Yeah, bow
instead of
hunting.
like yeah, like slaughter homes. Anyways, I really like them and it's like a subscription. Um but one thing I did want to pick your brain about was I also read it could cause mental health maybe disorders or however you want to call it. I saw ADD as one, which is what I have. Um, do you have any kind of info on that maybe someone should look out for if they're hypermobility and trying to figure out how this is all connected?
Yeah, so keeping in mind it's a connective tissue disorder. So it not just your skin, not just your intestines, but also your veins. So from what I have learned, your vein walls are essentially it's tissue, right? And when it's too lax, of course, what happens is like the blood flows more freely. When you are in a fear state or an excitable state, right? What happens to your veins? They open, the blood starts pumping faster. You get the adrenaline, like you're excited, you're sharper, you're more stressed. When the vein walls are already more open, you're going to be more predisposed to having anxiety, to worrying
Mhm.
more, having higher cortisol levels. I haven't done a deep dive into exactly how it affects the brain literally, but
Mhm.
it's all connective tissue up here, right? So there's no way that it doesn't affect the way that you think. Like it can cause brain fog, like I said, depression, which also can come from like your gut when you're having issues in your gut. There is, but also just oh, here's my cat.
Love.
But also just doctors not listening. That doesn't help your mental health
Mhm.
either. I know I've been trying to talk to my doctor, trying to get this diagnosis. And I literally went to her with like a list of like 20 symptoms. I'm like, look, I have a large wingspan. I've had hernias. I've had sprains. I needed braces. Like, these are all, I was like, I can literally bend just like that. Look at what my elbow can do. Like, just showing her like all these things. And she looks me dead ass in the eye and was like, I mean, she was talking about Marfan, but she was like, your face isn't gaunt enough. Hmm. Okay. Right. And then I finally, like, a few months later, I was like, no, I need us to do this. She's like, okay, I'm going to send you to an occupational therapist. Okay. So I'm in occupational therapy for my literally floating shoulder. Turns out it just kind of floats a little bit. Like, the scapula is not properly attached because of the serratus anterior being weak, right? Which then it's a whole thing.
Mm.
And that's been really helpful with the education, going to physical therapists, getting all of that. But it is frustrating to not be listened to. And then if you have POTS, dysautonomia, which I'm learning I have, you know, you're going to have doctors who be like, you're just stressed. It's just anxiety. I would say that that's also a big part of mental health. It's just not being believed. And the fact that it affects women more than men, and we know how little women are listened to and researched, that's why hypermobility isn't researched or educated on very much, is because it mostly affects women.
Yeah.
And
Mm.
everybody knows science is biased.
Yeah.
Yeah, it's unfortunate. That is a hard pill to swallow because there aren't doing a lot of research on, women as test studies and things like that. And I feel like it's
Mhm.
interesting. We've talked a little bit about, health practitioners and how to really have Eastern medicine and Western medicine complement each other in your like whole health journey. And I feel like it's really hard because like in your case, it feels like and most it's a real personal relationship that we need to have with our healthcare practitioner for them to really put all of the puzzle pieces together and help us understand the complete picture. And just with the reality of our healthcare system today, a lot of times we're not having personal relationships. We're going in with
Yeah.
symptoms. They're doing the best they can on, okay, well, it's this, it's that. And they're trying to give you an answer in one session where that doesn't always fit the bill. And that I know can be like
Mhm.
so frustrating. I actually had a very interesting conversation with a colleague the other day who said that her sister uses a concierge doctor. So she pays $1,000 a year for a like retainer fee. And then she can go and see this doctor as often as possible or as she wants and like has that personal relationship. One, I think this is so cool. Two, I think the price barrier is fucking stupid. And I think that it should be something that we all have with our doctors. But I
Yeah.
think that to me, just knowing that that service exists is really a clear indicator that this is a need, and it's a need that we all like wish we had. And so maybe the pendulum will swing. Long rant over to say, like, yeah, I can imagine that's really frustrating. And it's hard. It's
Yeah,
hard when you're in and out and you're like, no, no, we have to put this together.
I agree. And I want to hear kind of how you decided to take on as a yoga teacher, a yoga instructor to really I mean, I'm super excited for you. I think you're going to help so many people. What was the turning point when you decided, okay, I'm going to specialize in this, and I think yoga instructing is going to be a way where I can help most people?
I think it really clicked for me. I was learning about it. I had bought a whole bunch of books, just like devouring them. And I mean, when I say books, it makes it sound like there's a lot out there. Um, there's not. There's like less than a dozen books about hypermobility, and even less than that tied into yoga. So I've read all of the ones that tie into yoga, and they're all just like, this is not talked about, and then I'm really saying I wish someone had had this information, because for example, like I mentioned with my shoulder, I'm learning for a lot of hypermobile people, their serratus anterior is extremely weak, right? So they essentially have kind of like a floating scapula, and then as a result, like, their shoulders kind of bow forward, which then hinges inside the shoulder, which can create impingements. I've learned it's irritated the hell out of my posterior deltoid, which worked its way down my arm, irritating my elbow, which then I struggle to use my wrist now,
Mhm.
because all these muscles are trying to make up for this deficiency in the serratus anterior. And I'm like, okay, well, if I'm living this, and I'm living this and learning this at the same time, I'm seeing professionals, talking to professionals, doing these studies, I feel like I can offer a lot. So it was probably around the end of December that it just all of a sudden one day I was like, this is what I'm going to do. I'm going to specialize in hypermobility. Like, this is it.
Yeah.
It just was one of those like divine downloads that I was like, this is it.
Yeah,
This is what I'm going to be doing for the foreseeable future.
I love that. I'm so excited for you. Um, are you practicing now, or do you have any events coming up?
Yes, so I'm working towards my 300 hour, so I can be 500-hour certified. And part of it
Yay!
is I have to actually like teach,
Mhm.
and then the people have to like sign off on paperwork, be like, yeah, she actually taught me. And so I'm teaching 2 classes at DOSRAC in the middle of April,
Oh my
doing a beginner
goodness.
hatha series. Yeah. And I am also doing a yoga at the Empress here in New Braunfels on April 19th, doing also beginners yoga. I really want to focus on beginners to help people learn how to move their bodies in the safest way and create a better foundation. So doing that. And then there's a couple private events that I'm doing. And just, I also now teach free yoga on the first and third Saturdays online.
Oh.
So doing hatha, because hatha is the best for hypermobile people, because you can move gently between each pose with a lot more intention.
Mm,
Vinyasa is very flowy, which is great, except that you kind of like lose structure in your joints and you can hurt yourself more. So
mhm.
I focus on hatha yoga. And so, yeah, every first and third Saturday, 10 a.m., doing online yoga for people.
Yes. Okay, we're gonna link all of that.
Definitely.
Congratulations, Jen. And seriously, thank you for coming and blowing our mind. I am speaking for Kaylee because my mind is blown. But yeah, I really appreciate it. And I know there's someone listening who is experiencing even maybe some of the symptoms that you described and haven't found the answers yet. So if you're listening and you relate to this episode, or if you want to have, or if you have more questions, please DM us at the Besties Unscripted podcast, or you can DM Jen if you're comfortable sharing your Instagram or TikTok.
Mm-hmm.
Okay.
Definitely. Definitely. I actually don't have an Instagram. I am on TikTok and Facebook.
Awesome. We will link all that information. And thank you so much for joining us and for having an enlightening conversation about our whole health, which is really important. And we appreciate you. We will see the rest of you besties next week. Bye.
Bye.